Here we'll talk about fall in elderly using this mnemonic BMW, heart under I symbol. So B stands for brain. So in the conditions like paranoia, confusion, Alzheimer's, Parkinsonism, or any drug contraindications also, psychosis, neurological epilepsy, stroke. So these are the different conditions which lead to fall in elderly when it is related to brain. Coming to M, musculoskeletal, arthritis, any stiffness in the joints or weak muscles or joint pain, and also giving away of the knee. So these are the different conditions which are related to musculoskeletal. It can be arthritis, stiffness in the joints, myalgias, arthralgias, right about all those things, and weakness in the muscle. The heart, so drop attacks. So just write about BP. So change in the BP, change in the postural hypotension, and syncope. So arrhythmias and the drop attack. So these are the different conditions related to heart. So coming to the eye, when they cannot see properly, like for example cataract and decrease in the visual field, visual acuity. So these are the different cases. And weakness, because of old age, they become frail. So these are the different causes. So B stands for brain. Write the conditions like Alzheimer's, Parkinsonism, paranoia, confusion, all these things, right? Epilepsy. And coming to M, musculoskeleton, write about arthritis, stiffness in the joints, myalgias, arthralgias, weak muscles, and all. So coming to W, it means weakness. As the age increases, there will be weakness, so frailty. And heart symbol for about heart, like drop attack, syncopes, change in the posture, so change in the BP, all those things. And I for cataract, decrease in the visual field. So first there will be bruising, fractures, or they can fall into something which is hot and they can cause this burns, dehydration, brain hemorrhage, so all these things, and decrease in the activity, so which will lead to decreased activity. They may always be bedridden, which can again give rise to lot of other conditions, and loss of tone, stiffer joints, and depression. So mentally they will be depressed, lack of confidence, fear, inability to leave the home because they might feel like they might fall frequently, inability to travel or follow hobbies. They'll have this restricted lifestyle. And that if there is any hip fractures and which can lead to this embolism conditions like that, they can die in several cases, right? So what are the things you'll write? First you'll write about bruising, fractures. If there is severe fractures, they can also die because of like embolism and all. And also if they fall into some hot substance or something, they'll get burns. Dehydration, so just write burns and dehydration and all. Hemorrhage, internal hemorrhage can occur in the brain. So all these conditions will cause fear in them, right? So there will be depression, fear, lack of confidence. They won't leave the home, they won't follow their hobbies, they won't travel, they have very restricted lifestyle. So these are the different effects of fallen elderly. So now coming to the treatment, how will you treat them? First, look at their medications. If there is any high dosage of the sedatives or benzodiazepines, change that, right? Review the medications. And also environmental hazards, like you can install this grab bars where they can hold this and walk to prevent this fall, right? So grab bars can be installed in the environment. So environmental hazards. And the gait impairment, so in the gait impairment you can train them with the balance and strength, right? So balance and the strength exercises. So balance impairment, again you'll give them balance training and exercises. So for muscle weakness, work out with the resistance bands. And postural hypotension, head elevation and the hand clenching, these can help. So this is about fallen elderly. Bye.